Recording in progress.
I'm waiting for a cue. Get ready? Yeah. Good morning, everyone. I'm Lee Soda, and I have the privilege of working at Agincourt Community Services, and you are all in the Dorset Park Community Hub. Welcome. The Community Hub is a place where residents come to gather, meet, and share in programming and access social services that contribute to the overall health and well-being of people. And when people are healthy and well, then we have strong, vibrant communities. We're very excited about today's announcement, and it is my pleasure to introduce a true community champion, MP Salma Zahid.
Good morning, everybody. Thanks a lot, Lee. Before I begin, I would like to acknowledge that we are on the land we are gathered is the traditional territory of the Wendat, the Anishinaabe, the Hanisnak, Métis, and the Mississaugas of the Scarborough and Elderville First Nation. Thanks a lot, Lee. It's really great to be here at the Dorset Park Hub. It's a place where community comes together, and Lee has always been there to serve the community. So thank you for all the work which you do. My name is Salma Zahid, and I'm the Member of Parliament for Scarborough Centre. And joining me today is Honourable Mark Holland, Minister of Health. It's always great to be here in Scarborough to deliver some good news about the Canadian Dental Care Plan, also called as CDCP. In just a few moments, you will hear about all the next steps we are taking so even more Canadians across the country from coast to coast to coast are able to receive the care they need. I would also like to extend a big thanks to Dorset Park Hub for hosting us today. The Dorset Park Community Hub provides a one-stop shop for Dorset Park residents seeking important services, programs, and the community space. The incredible team has contributed immensely to support our efforts to help Canadians receive the oral health care services they need to stay healthy. So after the announcement by Minister Holland, there will be an opportunity for media to ask questions. Now it is my honor to introduce to you today a very special guest, the Honourable Mark Holland, Minister of Health. Minister Holland was first elected as Member of Parliament for Ajax in 2004. As a Member of Parliament, Minister Holland has served as the leader of the government in the House of Commons, as Chief Government Whip, and also as Parliamentary Secretary to Minister of Public Safety and Emergency Preparedness. He has been a staunch advocate of marriage equal rights and played a key role in helping to reform Canada's animal cruelty laws. In both public and private roles, Minister Holland has backed health-related initiatives. He served as the Executive Director of the Heart and Stroke Foundation of Canada's Ontario Mission, as well as the National Director of Children and Youth. So please join me in welcoming Minister Holland here to Scarborough Centre. Thank you.
Merci beaucoup, Salma. C'est absolument un grand plaisir d'être ici avec vous aujourd'hui et de partager les bonnes nouvelles. Vraiment, une étape vraiment importante pour notre système de santé. But I want to start by thanking Salma for hosting us here. Salma, who's an incredible champion of connecting people to care. And there isn't a chance that Salma doesn't take to stop me and tell me about how we need to do better and to focus on the people who are vulnerable, people who often don't have voices and who need to be heard. And I want to thank you for all your incredible advocacy and for hosting us here today. I also want to thank Lee Soda. Lee, AXA, I'm getting to hear all the incredible things you do. You know, the initiatives you're starting, from working on food banks to connecting people to care, to really being there for people at their moment of need, sometimes when they're really scared, stepping in and providing them with critical support. So thank you. Et aujourd'hui, le réseau canadien soins dentaires a franchi une étape importante. 1 million de Canadiens partout au pays ont reçu des soins de le cadre du régime canadien de soins dentaires. Plus de 2,7 millions de personnes au Canada ont obtenu l'autorisation pour bénéficier d'une couverture. À partir du 1er novembre, le régime canadien soins dentaires acceptera les demandes de remboursement sur le papier pour le service couvert par le régime et commencera à accepter les demandes de services nécessitant une authorisation préalable. And, you know, think about that for a second. 1 million people. It's a hard number to get your head around. I like to think about it, you know, I don't get to do it as much as I'd like, but, you know, going to a hockey game, you know, not too far from here in the Scotiabank Arena, 1 million people, that's 53 times that you would fill the Scotiabank Arena. That's people who are being connected to care. And with Salma and Lee, we had a chance to say hi to some of the people for whom that has touched their lives. On average, it saves somebody $730. And that's a big deal at a time where global costs are increasing. But it's also a big deal because it's a fundamental matter of dignity. See Marg here, Marg, who's with the dental hygienists who've been champions of this program for day one. And I'll tell you, I was just in Niagara a week or two ago talking with dental hygienists about their passion for prevention. And you know what they tell me? One of them said to somebody on our team, I hate this program. And I said, you know, the person said, what do you mean you hate this program? And they joke, because my back's so sore from helping seniors. And that's what this is about. 1 million people getting access to the care that they need. In that same conference, you know, with dental hygienists, hearing from them about, you know, yeah, somebody came in and I was able to talk to them about some other medical issue they were having, a conversation they otherwise wouldn't have. I was able to connect somebody with a pair of dentures. Imagine that. I mean, one of the first things I did was visit a clinic in Vanier and 2 denturists named Dan and Jack. And they said they have a woman very early, first days of this program, came in 40 years, the same pair of dentures. It was down to like plastic plates in her mouth that she was crunching her food painfully every day. And now she has a new pair of teeth. Walking around with a smile she's proud of. That's dignity. I would say that's Canada. That's the kind of country that we need to have. Now, there's a lot of people who said this thing wasn't going to work, right? And there's always the people, like, you're not going to do this. It's not going to happen. The early days of this program, conservatives said it doesn't exist. Nobody's going to sign up. No oral health professionals are going to be there. 89% of oral health professionals are now participating. That's 22,300 professionals who are connecting people to care. Now, a lot of times I have people say, yeah, but you know, why are you focusing on this dental thing? We got a real issue in primary care. Well, Marg, you know this. It is primary care. You know, a lot of people haven't seen a health professional in a long, long time. They finally have dental care, that pain in their mouth. You know, I think of somebody like Maggie Ray out in Nova Scotia, young person, only 17 years old, thinking about her future. She has pain in her mouth. She's living with her grandparents. She probably wouldn't even have gone in because she knew that that pain in her mouth was going to cost way too much money. But she went in, found out she had to get her wisdom teeth removed. That procedure was going to cost over $2,000. Maggie Ray would have been left in a position to choose her future, her education, or her mouth, because those teeth would not only have been painful, they would have warped and contorted her teeth. And that's profoundly unfair. Why should that happen? Not in Canada. So it's essential that this continue, but it's a beacon to what is possible. And this is what I would say today to all of those who say that change isn't possible within our system. In 6 months, we've been able to see 1 million Canadians. These are people who did not have access to care. These are people who won't wind up in emergency rooms. These are people who will have preventative work done so they don't get sick. We need to do this across our health system. This is a conveyor belt of progress that we cannot stop. And next on that stop is pharmacare. You know, right now in Canada, it costs us over $30 billion a year to manage diabetes. And how do we deal with it? We wait until people get really, really sick and the bills are incredibly high, and then we got to pay for it in our hospitals and our emergency rooms, instead of connecting people to the medicine that they need. It's essential that people have that medicine, not just as a matter of justice, but like when I'm talking to a doctor and a doctor says to me, why am I even seeing these patients? They can't take their medication. They're going to wind up with a much more serious illness. They're going to wind up blind or with a limb amputated. It is a dumb way to do business. We must do better. Yesterday, I had a chance to meet with Daryl Fox. We had a chance to talk about the incredible work the Terry Fox Foundation is doing. And we had that chance to talk about Terry's vision for this country. It was a vision, yes, of eliminating cancer, but really it was a vision, I think, of eliminating illness overall. And imagine the vision of Terry Fox at 18 years old to imagine a world where cancer was defeated. It seemed like a pipe dream at that time. But right now, 70% of the things that fill our hospitals, our emergency rooms, and our doctors' offices don't need to be there. They're preventable. Do you know how much money that costs us? Think about how unsustainable that is. So I know sometimes it's hard to connect to prevention, but it is everything. You know, in Canada, and I'll end on this, in Canada, we have a health span that's second longest in the G7, one of the longest in the world. People say, well, what's a health span? This is a really important fact. Health span is how long you live in health and not in disease. We live a year longer than France and Italy in health in Canada. We live 2 years longer in health and not in disease than the UK. We live 6 years longer in health in Canada. And it's getting better every year. And we need to accelerate that. Because we're thinking about prevention, hopefully we can also think of the last 10 years of our lives. To imagine in the last 10 years of our life that it's free of disease and illness, that it's full of family and joy and happiness, and yes, productivity, and yes, avoidance of cost. That's possible. And no, we can't get there overnight. But person by person, we got to 1 million. Person by person, we will connect people to the diabetes medication that they need. Person by person, we will ensure that every woman in this country gets access to the reproductive tools and medicines that she needs so that she has autonomy and control over her own body. Step by step, we will integrate our data system. We will ensure the school food program connects kids to food. We will make, through the bilateral agreements that we have done, team-based care a reality where every Canadian has access to a family doctor and to a family health team. We do these things not just because they are just, we do them because we must, because the alternative is far too costly. It's far too costly as a matter of social justice, and it's infinitely too expensive. With that, I'm really excited to continue the work. Thanks so much for being here today.
Thank you, Minister. Thanks a lot for the work which you do and all the hard work in the last 6 months, which has allowed like 1 million Canadians from coast to coast to coast to be able to connect with their dentist and take care of their oral health. So that means a lot to all Canadians and the constituents here in Scarborough Centre. So thank you. With that, I will pass it on to Dominic for
Before
the...
Sorry.
Yes.
I can see that I'm being looked at. And in my excitement to talk about all of this, no, I just want to mention two things. One, tomorrow, pre-authorization, predetermination goes online. 2, paper claims come. This is a big deal. I just want to mention I got excited, so I didn't get to it. But I'm very excited because tomorrow we expand coverage. That means more complicated procedures are going to be able to be embarked upon. And we've worked very hard for that to work as seamlessly as the rest of the program. I'm excited. I mentioned we're at 89% of oral health providers. One of the reasons we're not at 100 is because some are still paper-based. That's coming tomorrow as well. So the progress continues. Sorry, Salma, I'll turn it back to you.
Thank you, Minister. And I will pass it on to Dominic for the media questions.
We will now proceed to questions from journalists in the room. Please state your name, media outlet, and whom your question is directed to. You'll have the opportunity to ask one question with one follow-up. Nous allons maintenant passer aux questions des journalistes présents dans la salle. Veuillez indiquer votre nom, votre média et le destinataire de votre question. Vous aurez la possibilité de poser une question avec un suivi. Let's proceed to the first question. Nous allons passer à la première question. Okay, no questions. We will pass to the Zoom now for any further questions. Nous allons passer à Zoom maintenant pour toute autre question.
Thanks, Dominic. If you're a journalist on the Zoom and wish to ask a question, please use the hand raising function. Si vous êtes journaliste sur le Zoom et vous désirez poser une question, veuillez utiliser l'option de lever la main. We have a question from Marina von Stackelberg of CBC News. Marina, please go ahead.
Hey there, Minister Holland. Happy Halloween. My first question is, this program is expected to expand massively in 2025. Are you on track to expand to all remaining Canadians in January?
Yeah, so it was never January. First of all, Marina, hi, good to see you. Happy Halloween, everybody. It's a good day to talk about oral health because we want to enjoy our candy, but we got to take care of our teeth afterwards. So yes, we are on track to expand in 2025. It will be, we haven't set on the exact date. That's still being figured out. Because we obviously are tracking very closely how predetermination, pre-authorization, and paper claims go. But early in 2025 is when we're looking to start expanding to additional cohorts. Because as I should say, right now we're seeing everyone 65 and older and 18 and under. So for those that are in between those age groups, those cohorts are coming in 2025. But we didn't say January, we said 2025.
You mentioned cohorts there. So are you expecting to do specific groups still? Because until now, we've basically heard 2025, the rest of Canadians that aren't part of these three separate groups. So are you expecting to do chunks of people still?
Yeah, thanks, Marina. So the idea here is we're covering everybody. It's going to happen in 2025. What we've done, if you look at this, and I had an opportunity to talk with folks here about how the plan is working. It's been very, very smooth. It's been operating with very few hitches, and we want to make sure we continue that. So we're in a process of constant evaluation to make sure that as we bring new people online, and right now we have 2.7 million people who are registered, that they're being connected appropriately to care, and that we're listening and having and incorporating that feedback from oral health providers. This pre-authorization, predetermination, it's a big one. Like, we got to make sure that we nail this. I'm very confident we will, but we're going to be evaluating that. And that's going to put us in a position to make a determination on exactly when we roll out those next cohorts. But we are absolutely committed in 2025 as fast as possible to expanding this to all Canadians.
Thank you, Minister. There are no more media questions on Zoom, so that'll conclude today's news conference. Any additional questions can be put to Media Relations at Health Canada. La conférence de presse est maintenant terminée. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à Santé Canada. Merci et bonne journée. Thank you and have a nice day.
And thank you to everybody here. Really appreciate it. Thank you. And thank you as well to the clinic. I know that this community hub is so busy, but really appreciate you, Lee. Thanks so much for having us. Yeah, thanks so much. Really appreciate it.
Thank you.
Salma, thank you.